So number 6, I'll leave it a little longer and I'll see how it goes. Anybody heard that one? The vein of your life. I'm kind of interested, but I'll just leave it a little longer and I'll see how it goes. It means I'm very close to making a decision. I just don't trust you yet. That's it. It's all to do with trust, and you have to live there. You've got to stay there. I just don't trust you yet. Yet means you've got something to do. It really means you haven't done something, and that's a big point in life. Again, from a business owner point of view, what we find is people. I don't ever doubt that people in business are working hard, and people say, "Paul, I'm doing this. I'm doing this. I'm doing this. I'm doing this." I'm like, good, let's talk about what you're not doing. And that's usually where the growth is in a business. And it's the same here. Paul, I'm speaking to this person, I'm on the phone, I'm sending them emails, I'm following up with them, I've sent them a letter. Good, what are we not doing? There's something you're not doing. Don't talk to me about what you are doing, tell me what you're not doing. So objection number 6, or what would you say and do? Most patients forget, which is big. I'll leave it a little longer and see how it goes. Most people will forget how long they've actually suffered. You've all had assessments where a patient walks in, how long have you been suffering? Oh, it's only a couple of weeks. Well, now you come to mention it, it actually is a couple of years. And then they come back in a week later and they're like, actually, I think this started about 10 years ago. That's their brain again, playing tricks on them. They forgot when this whole thing started, and it's only when they have a conversation about how long it's actually gone on for, do they go, shit, like mentally, how much time has gone on in between this thing? So most patients forget that nothing has changed by doing nothing. So, thanks Simon. Has it gone off? I think we're gone. You need to remind them of it by asking them to tell you again how long. Then, swing back into another question that gets them talking about their values and goals. We need to remind them, the moment that they tell you, I'll leave it a little longer, I'll see how it goes. Your initial response is, tell me again. How long has this gone on for? When did it start? Go straight back. Don't say, okay, give me a ring. Give me a ring when you're ready, because guess what? They'll never be ready. They're never ready. So remind them, swing back to another question that gets them talking about their values and goals. So what that means is they say, look, Paul, I'll leave it a little longer and I'll let you know. Just tell me again, Dave, how long has this been going on now? That's your breathing space to be able to think about what your next question is. And really what you're doing, you've got one ear listening to what they're saying, but the other part of your brain, if you like, is starting to think, what's your response? And that's why the longer that you can get them to talk, really, your ability to sell will become easier. Because if they're talking, you're essentially sitting back on what's my response, rather than the other way around. Think about what really happens. You're talking. The patient's coming up with their response as to why they can come out. Seriously, think about the situation that you're often in. The longer that you speak, the longer that they have to come up with an excuse about why that's not valid for them. You're on the back foot. What we want is them speaking, and you're literally going, okay, keep coming. Now I'm coming back with a question that will support where I want this relationship or this conversation to go. So if I ask them, swing back to another question that gets them thinking about their values, I might say, okay, tell me again, how long's this been? Person speaking, I'm thinking. Oh, good. And again, hiking, wasn't it, that you wanted to get back to? Tell me more. How often do you go? Is it weekly? Is it daily? What's been going on? Who do you go with? Do you go with family, friends, part of a club? Is this a social thing? Or is this a fitness thing? Tell me a little more. Well, I go every other day with my husband. We like to walk after work. Oh, good. So this is something that you and your husband love to do. Tell me, how long have you been doing it? Is that how you met? Boom. Now I'm in. Now I'm having a conversation again. How does your husband feel about not being able to go for a walk on a night? Does he go on his own now? Does he go with another lady from the club? I never thought of that. I'm in. Sign me up. How much is it? So the longer that they talk to you, the more trust that you will build and the more unanswered questions you will be able to answer for them. And that's really why we need the 35, 40-minute conversation. They are forgetting the consequences of waiting for more time. Again, you are allowing them to forget that untouched low back problem, knee problem, etc. potentially could lead to a lifetime of pills, surgery, never getting back to that hiking that they love, injections, loss of mobility, and all these types of things. You're not using scare tactics, you are explaining to them, this is the thing that you need to be aware of. Much like I would appreciate my dentist telling me, Paul, you may choose not to take that tooth out today and spend the money on the thing that he wanted to put in. But I need to tell you that the consequence of that is your other teeth will be eroded. You run the risk of the tooth in front being decayed in the next 2 years, and you will be in for a lifetime of problems with things like gum disease and whatever else. He's not scaring me into buying. He's doing his fucking job. He's doing his job, because I'd hit the roof in 3 years' time if I later found out that he didn't tell me those things and didn't at least give me the option to make a decision on that. And again, don't be fearful of doing it. All the bullshit of scare tactics and so on. This is not scare tactic, it's the fucking truth. That if somebody's sitting there with 5 years worth of knee pain, you're not having a conversation with them about what that might look like in a few years. Jeez, how long's that hip been tight? Oh, 5 years. Where's this going to go? It's going to go to knee problems, back problems. Probably is a back problem anyway, causing the bloody thing. Is it? Didn't know that. That's my job, to point these things out to you that ultimately help you make that decision to buy from you. So you may choose to leave it a little longer, but I just want to let you know that these things happen to people who do leave this type of thing. And if I've done 5, 10, 15 minutes conversation back and forth about what the problem could be, I'm well within my rights to make that type of conversation happen. Thanks for watching this video, and if you found it helpful, and if you now find yourself thinking, I wonder what else this person can help me with, head over to paulgough.com/books, where you can find my best-selling books, which will show you how to add more profit to your practice. Or send an email to paul@paulgough.com to ask about how we can help you accelerate the growth and profitability of your clinic. And by the way, if you know anybody who would find this helpful, please share this video out. Thanks so much.